tuberculosis or TB. Tuberculosis or TB is a disease caused by a bacteria, Mycobacterium tuberculosis. The bacteria usually attacks the lungs. However, it can attack any body organ, including the brain, the spine, other organs like the kidney, liver. Tuberculosis is preventable and treatable. It is the world's deadliest infectious disease killer. Having tuberculosis means that the person can spread the infection to another person. Tuberculosis is spread through air from one person to another. It is spread when the person talks or coughs or sings. People may breathe the germs and then become infected themselves. When the person breathes the germ can settle in the lung and begin to grow. Then the germs can spread to the blood and other body organs. Anyone can get tuberculosis. Some people may be at higher risk depending on where they were born or where they live or some medical conditions. There is latent tuberculosis and active tuberculosis. Most people who breathe tuberculosis germs become infected. The body is able to fight tuberculosis to stop them from growing. That's when the germ becomes inactive or latent or asleep. The germ is alive in the body and it can wake up or become active later in life. When the germ is inactive, it is called LTBI or latent tuberculosis infection. The person with latent tuberculosis has no symptoms, has a normal chest x-ray, cannot spread the infection, will have a positive tuberculosis skin test or a blood test. Again, this person may develop active tuberculosis if the latent tuberculosis is not treated. If the tuberculosis wakes up, then it becomes active tuberculosis infection, and the treatment for latent tuberculosis and active tuberculosis is different in medications needed, length of treatment, and monitoring. Treatment of latent or inactive tuberculosis is essential to controlling tuberculosis and preventing activation of tuberculosis. Treating latent tuberculosis reduces the risk that the infection progresses to active tuberculosis. Active tuberculosis is when the immune system cannot stop the germ from growing or replicating. The germ multiplies or wakes up in the body and then causes active symptoms, including an abnormal X-ray. Besides the lungs, it can also affect other organs. Some people can develop active symptoms within weeks of infection. Some other people, it may take years to develop active tuberculosis. Some people never develop active tuberculosis. People with active tuberculosis can spread the infection. They can pass it to their family members and friends and others. When someone has active tuberculosis, they need several medications. They may need to be hospitalized, and the doctor needs to make sure that that person is not infectious, that they cannot spread the germ to other people. About 5 to 10% of people with latent tuberculosis will develop active tuberculosis during their lifetime. Sometimes it is hard to know who is the person who's going to develop active tuberculosis. There are people that are at higher risk of developing active tuberculosis, again, depending on the medical conditions, medications that they may be on, aging, among other factors. Higher risk of developing active tuberculosis includes people who recently got infected with tuberculosis, people with diabetes, HIV, substance use disorder, immunosuppressants, organ transplant, kidney disease, cancer, steroids, among others. Symptoms of active tuberculosis may include cough that lasts longer than 3 weeks, coughing blood, chest pain, fever, night sweats or chills, loss of appetite, weight loss, weakness or fatigue. People should get tested. There is a skin test and there is a blood test. The blood tests include a quantiferon and a T-spot. If a person has a positive TB test, whether it is the skin test or the blood test, they will need a chest x-ray to differentiate between latent or inactive tuberculosis and active tuberculosis disease. If there is a chest x-ray abnormality, that person may need to submit a sputum sample for active infection. The TB blood tests are not affected by prior BCG vaccination. Therefore, TB blood tests are preferred for people who have received the BCG vaccine, among other factors. People with latent tuberculosis can be treated. There are different treatments and different lengths of treatment. It will all depend on patient preference, provider preference, medical conditions, and potential medication interactions, among potential side effects. Usually, the treatment for latent tuberculosis is either a 3-month, once-a-week isoniazid and rifampicin, or 4 months of daily rifampicin, or 3 months of daily isoniazid plus rifampicin. There are other treatment options. Treatment may have side effects. It is always important to discuss with the doctor. Active tuberculosis will require more medication and a longer period of time. Treatment is needed for a prolonged period of time, whether it is latent tuberculosis or active tuberculosis. Tuberculosis dies slowly, and it may take longer medication courses to completely kill it or eradicate it. For tuberculosis infection or active tuberculosis, it is at least 6 months or longer to kill all the germs. It is important to complete the treatment as directed, and if the person has active tuberculosis, it is important to be isolated to prevent infection to others. I hope this topic was helpful. Thank you.